Now, you seeing this image with all that redness, what stage of COPD is this, and are there different stages of COPD?
Definitely. We can definitely classify this based on the inflammation and the destruction of the alveoli, and this will be a case of severe COPD. And that's because it affects the deeper areas of the lungs. So when COPD starts, and we will have to go back to the previous representation or image, but it will go and start affecting the areas with typically the etiologic agents affect the human being. It's actually the trachea and the primary bronchi, and which is the tubing system that are essentially up on the anatomy, and then it goes deeper into the alveoli. So classification goes into the mild aspects when it affects only the first areas, the more moderate when it affects deeper areas of the lung, and the severe stages in which the alveoli, which is the units that I presented to you before, are also affected.
Now, doctor, how long does it take for the symptoms to occur?
Well, it's an evolving situation. It can happen over a few years. It can happen over many years. So most people start having symptoms of COPD after exposing themselves to the causal agent for about 15 to 20 years. But for some people, that might be earlier than that. And for some people, it might take longer than that. Unfortunately, it's something that we don't know. And as happens to us and human beings, is we start doing things and we never thought, or we never think that it's gonna happen to us. We always think, this is not gonna affect me.
Right.
This is not gonna have cause. And that's something very important. As in the video, we could see one of the testimonies. You know, my mom told me to quit smoking, but it was late when I did it, or I couldn't do it, or I didn't want to do it. And I think this is very important because when we're young people, we start smoking, and as we get older, we start getting affected by the disease, and unfortunately, sometimes too late to regain what we lost already.